Sakthi Dental Clinic, Mullukurichi. Flexible removable partial dentures, RPDs, are a type of dental prosthesis used to replace missing teeth when some natural teeth remain in the mouth. Unlike traditional RPDs, which are typically made of metal frameworks and acrylic, flexible RPDs are constructed using a flexible thermoplastic material. Here are some key points about flexible RPDs. 1. Material. Flexible RPDs are usually made from a type of nylon material, such as Valplast or Flexite. This material is lightweight, durable, and resistant to fracture. It also has a degree of flexibility that allows for easier insertion and removal. 2. Aesthetics. The transparent or tissue-colored material of flexible RPDs blends with the natural gum color, making the prosthesis more aesthetically pleasing. The clasps used to hold the RPD in place can also be made from the same flexible material, minimizing their visibility. 3. Comfort. The flexibility of the RPD material can provide enhanced comfort compared to traditional rigid RPDs. The flexible material conforms more closely to the shape of the oral tissues, reducing pressure points and irritation. This can result in improved comfort during speaking, eating, and other oral functions. 4. Retention and stability. Flexible RPDs use clasps or attachments to anchor the prosthesis to the remaining natural teeth. The flexible nature of the material allows for a secure and snug fit, improving retention and stability of the RPD. 5. Metal-free. Flexible RPDs are an attractive option for individuals who have metal allergies or sensitivities since they are metal-free. The absence of metal eliminates the risk of allergic reactions or discomfort associated with metal components. 6. Adaptability. The flexible material of RPDs allows for easier adjustments and modifications as needed. If there are changes to the oral structures or additional teeth need to be replaced, the flexible RPD can be adjusted or extended without the need for extensive remaking. 7. Care and maintenance. Flexible RPDs are relatively easy to clean and maintain. They can be cleaned with a toothbrush and mild soap or denture cleaner. It's important to follow the dentist's instructions for proper care and maintenance to ensure the longevity and effectiveness of the prosthesis. It's important to note that not all cases are suitable for flexible RPDs, and the treatment decision depends on various factors, such as the condition of the remaining natural teeth, the number of missing teeth, and the overall oral health of the patient. Consulting with a qualified dentist or prosthodontist is essential to determine if flexible RPDs are the appropriate option for your specific needs. The dentist will evaluate your oral health, discuss the treatment options, and guide you through the process of obtaining a flexible RPD if it is deemed suitable for your case. Thanks for watching. Like and subscribe.